Lung cancer, adulthood and aging. So this is the topic, lung cancer. Definition of lung cancer. Lung cancer, it is a malignant tumor arising from the bronchial epithelium. It is characterized by uncontrolled cell growth, airway obstruction and metastasis. So lung cancer, it is a malignant tumor. Malignant is which can spread from organ to organ, tissue level and through blood link. It can spread to other organs, which is arising from the malignant tumor, which is arising from the bronchial epithelium, which is characterized by uncontrolled cell growth. Malignant tumor means uncontrolled cell growth, and it obstructs the airway. And the metastasis. Metastasis is a process by which the cancer spread from its original site, that is the primary site, to other different body parts. It can spread through the blood or through the lymph. So the etiology, the risk factors by which the lung cancer occurs. The lung cancer is caused mainly due to conditions such as smoking. Smoking is one of the important causes of lung cancer. The next one is passive smoking. Passive smoking means inhaling the smoke that is expelled by the smoking person. That is known as passive smoking. And then the air pollution and the occupational exposure, such as asbestosis, nickel and chromium. Asbestosis, the person who is working in the industrial field who inhale the asbestos, and the person who is in the chemical industries might expose to these chemicals, causing the occupational exposure. And radiation exposure, the person who is exposed to high radiation. Then the family history. Then the chronic lung diseases, the COPD. Chronic lung diseases such as the tuberculosis can also cause the liver, lung cancer, renal cancer. Classification. The classification of the lung cancer. First one is the non-small cell lung cancer. That is the most common type of lung cancer. Adenocarcinoma. Adenocarcinoma is the first cause of non-small scale lung cancer. It is the most common type of lung cancer, and it is commonly seen in the non-smokers. It is not spread through the. It's not seen in highly smoking persons. Then it is usually occurring in the outer, that is the peripheral part of the lung. Squamous cell carcinoma. Squamous cell carcinoma, it is more strongly linked to the smoking, and it is usually found in the bronchus region. It mainly cause cavities in the lungs. Large cell carcinoma, it is less common, but it shows rapid growth and it spreads early. It can occur in any part of the lungs. Then it comes the small cell carcinoma. Small cell carcinoma, it is highly malignant, it's aggressive, and it shows rapid growth. Then it shows early metastasis. Metastasis means it's easily spread from lungs to brain, liver, bone tissues. Also, this can only be treated through the process of chemotherapy or radiotherapy in surgery implemented for small cell lung cancers. Then pathophysiology. Pathophysiology means the process through which it occurs. The exposure to carcinogens. Exposure to carcinogenic substances. Then exposure to this substance causes the mutation in the lung cells of DNA. Mutation in the lungs cells causes uncontrolled cell proliferation. Uncontrolled cell proliferation means uncontrolled cell growth. Then uncontrolled cell growth forms tumor formation in the bronchial region or in the lung tissues. Uncontrolled cellular growth forms tumor in the bronchus and lungs. This causes the obstruction of the airways as well as the damage of the alveolar sacs. The alveolar sacs obstruction can cause the damage to the gaseous exchange. Usually the gaseous exchange takes place through the alveolar sac. So if the alveolar is damaged, the impaired gaseous exchange takes place. That is breathlessness, hypoxia, and metastasis to brain. This spread of this infection spread to the or the cellular growth through the blood, tissues and lymph, spread through the brain and liver cells as well as bones. So the malignant tumors, malignant carcinogens spread through the brain, liver, bones and other organ tissues. Then the clinical manifestations. What are the signs and symptoms of the lung cancer? That is the respiratory system. Persistent cough, frequent cough occurs. Hemoptysis refers to coughing up of blood or coughing of blood in the sputum. Then dyspnea means breathlessness. Dyspnea means breathlessness, and hypnosis is coughing up of blood. Then comes chest pain, wheezing. Wheezing means coughing or sneezing. Then what is the first cause? Persistent cough. Hemoptysis, that is coughing of blood. Dyspnea, that is breathlessness. Then chest pain, wheezing. The next causes are signs are weight loss, fatigue, as well as the loss of appetite. Then metastasis due to the spread of the malignant tumor, the malignant cancer, bone pain and headache. Medical management, how it can be cured or how it can be cured to a certain extent. That is surgery, lobectomy and pneumonectomy, then chemotherapy and radiation therapy, then targeted therapy, that is targeting the infected tumor cells, then immunotherapy, immunization, then palliative care, nursing management, assessment, checking the respiratory status of the patient frequently, then oxygen saturation, checking the saturation rate SpO2, then assess the pain level using the pain scale reading, then appropriate nutritional status should be maintained. The interventions, we should maintain the perfect airway patency, provide pathway for the airway obstruction if occurred, administer oxygen through flow meter. We have to administer oxygen out through the oxygen therapy. Position in a semi-porous position. Semi-porous position provides better pathway for the breathing, or it will clear the obstruction for the airway passage. Then using the for the pain management, use medications, medications, nutritional support, provide adequate nutrition, prevent the infection, and also provide psychological support to the patients who are facing the malignant carcinoma of the lungs. Then how to evaluate the condition of diagnostic evaluations in the chest X-ray, computerized tomographic scan, bronchoscopy, proboscopy, then with the biopsy, to sputum cytology, sputum culture, then PET stand for positron emission tomography, positron emission topography, then magnetic resonance imaging, MRI. These are the diagnostic evaluation by which we can determine the person who is having malignant cancer to the lungs. Thank you.